It's another opportunity for people around the world to unite in the bid against HIV and show support for people living with the virus. While different levels of successes have been achieved, there's still a lot that needs to be done. And to help us examine all of this, we have joining us from our Abuja studio, Dr. Sani Aliyu, the Director General of the National Agency for the Control of AIDS, and Victor Omoshein, Coordinator, Network of People Living with HIV/AIDS in Nigeria. Thank you for joining us.
Thank you for having us.
Thank you for having us.
Sorry, I understand the other person in Abuja studio is Walter Ugoche, Executive Secretary of the Civil Society for HIV and AIDS in Nigeria. Thank you for joining us, gentlemen.
Thank you.
Let's begin with you, Dr. Aliyu. What would you say is the state of this, of the efforts to combat the spread of HIV and indeed manage those living with the virus?
So Nigeria is currently in its third decade of the epidemic. We estimate we have about 3 million Nigerians currently living with the virus. But the good news is that we are making progress. We've just crossed the 1 million mark. We have about 1,050,000 Nigerians currently on treatment. We've also expanded on the number of facilities that are offering treatment through our partners. Just a few years ago, we had about 500 facilities. That's now gone up to about 1,000, close to 1,700 treatment facilities. In terms of when it comes to people dying of the disease, the numbers have been coming down as well because the drugs work very well. At the moment, we estimate that we have about 450 Nigerians on average dying every day from the disease, and that's a significant drop compared to what we had some years back. So yes, we're making progress, but we know that we still have a lot of work to do. We still have about 2 million Nigerians that need to go on treatment, and that's still that's quite a major challenge in terms of the funding. The sustainability of the program itself is also a big challenge. 95% of those people living with HIV at the moment are funded by external donors. The government of Nigeria, through the federal government, is taking care of 60,000 people living with the virus in Taraba and Abia State. But so it's a mixture, really. There's some good news, and at the same time, we know we have a lot of work to do. One other thing I wanted to say is we talk about the tipping point. Well, Nigeria has just passed the tipping point in terms of the epidemic. That's when the number of people going on treatment exceeds the number of new infections. So we are very much on the way to achieving epidemic control, but we need to put in more resources and we need to be more focused in terms of our efforts.
Okay. Mr. Ogoche, you work with people who are living with the virus, those who are working in that sector. Let's look at the feedback you get from the people you work with, civil society working with people living with HIV and AIDS. What feedback do you get from them?
So the feedback we got is in so many folds. So first is the feedback about the progress that we have made as a nation in the national response, where from 2000 to 2008, we had a number of people living with HIV and AIDS in bedridden in the hospitals and needing treatment and needing care. So that has changed a little bit now to a situation where we have a majority of those living with HIV and AIDS on their foot again, able to just go into the treatment centers and walk into those centers and get their treatment and go back to their families. And a number of them have also started to look at going back to work, which they couldn't do before because of the epidemic, and a number of them have also becoming useful to the society, so exponentially increasing our economic growth and a whole lot of that. We have also seen that the treatment centers were expanded in the course of the intervention in the last 17 years. We used to have barely less than 500 treatment centers, and now we have up to 5,000 treatment centers, both at the tertiary, primary, secondary, and the primary levels. And the feedback we're also getting is that treatment actually works in a very large way in country. If you're on treatment, you can be sure that you'll be useful both to your community, to yourself, and to the entire nation. Howbeit, there are also very big challenges that feedback challenges that we're getting from those in the communities and those we serve. And these challenges range from drug out of stock to issues of user fees and a whole lot of other challenges, and the adherence component, having to continue the adherence component we already have. And of course, the bigger picture, the bigger question is our response in country is largely funded by the donor. So if tomorrow, what happens to our treatment program in country if these donors should go, or if they decide to win off some of the components of the treatment they are currently supporting? So what happens? So that issue of sustainability, that issue of domestic resources or domestic resource mobilization is part of the feedback we are getting from them, and that's why we, civil society, have begun to engage with government to say we cannot continue to have our treatment program in this country to be funded by donors. The government have to be on board, and government have to contribute very meaningfully to the response. The National Agency for Control of AIDS have taken it upon themselves, and the president have declared that to all of us that he will put 50,000 patients on treatment every year. So we would like that to happen. We would like to see that happen. I'd like to make sure that the remaining 2 million people who are living with HIV and AIDS in Nigeria, who we have not yet tested, who have not yet put on treatment, that in the next couple of years that we get them and we reach out to them and we put all of them in treatment. South Africa and many other countries have actually passed those marks. We would not want to be left behind in 2030 when the world will be commemorating the era of ending AIDS. We don't want to continue to talk about HIV and AIDS in country. We would want to see it as one of those public health concerns, not just an epidemic concern that it currently is. Thank you.
Okay, Dr. Aliyu, it's quite worrisome hearing you say 95% of the treatment is being handled by foreign donors. That means Nigeria is only handling 5%. What does this say if these donors pull out for whatever reason? Where does it leave our HIV response?
You're quite right there, and government has already realized the risks we're running by continuing to allow the HIV program to be dominated by external players. And no country will allow its citizens for their health to be mortgaged to another party. And Nigeria is no exception. HIV treatment, the entire HIV response, is very expensive business. If you look at how much we spend across the board together with our partners, we spend on average about 600 to 650 million US dollars on the HIV response. That's actually the entire Federal Ministry of Health budget if you're going to convert the 2016 budget, which is about 260 billion naira to US dollars. So clearly the federal government alone cannot take care of this. What we need is a multi-pronged strategy, a strategy that involves different stakeholders and different tiers, looking both at states, the role of states, looking at the private sector, looking at health insurance. In terms of the states, which I strongly believe in the long run, the state governments should really take up the battle against HIV and to fund it properly. We have states that have not released anything for HIV in terms of budget releases for the last 10 years. We have states where 100% of all their citizens living with HIV on treatment are being catered for by external donors. That is not a situation that we should allow ourselves to continue to be in. And really, in the last few months, what I've been doing is I've been working quite closely with the state governments. We've visited a number of states. Some states are doing extremely well, like Lagos and Kaduna. States like Oyo State, for instance, the wife of the governor has taken the battle really right to the forefront and is doing pretty good work. But for some states, I think they need to be aware that in the last few years, through our World Bank grant, we have built capacity for the state agencies for the control of AIDS. They need to take this up and start funding these state agencies for the control of AIDS and the state ministries of health to start running their own treatment programs. It's really essential. We have at least 9 states that have less than 50% of the people living with HIV covered in terms of antiretrovirals. And by the time we bring this down to state level, it's actually not that expensive. It costs about 50,000 naira per patient per year. The other thing is looking at the role of innovative financing, such as health insurance, for instance. And we have been working closely with the National Health Insurance Scheme to see if we can integrate HIV into the health insurance scheme, especially as we talk about universal health care coming into the country so that all Nigerians have access to antiretroviral therapy. And again, I will appeal to our philanthropists as well, the private sector. This is a cost that a lot of our philanthropists can also take up. Why don't you sponsor clinics? Why don't you sponsor HIV clinics in your localities? Members of the National Assembly, for instance, that run constituency projects, why don't you take up responsibility for some of those clinics in your areas and sponsor them? Because you are keeping, when you put a patient living with HIV on drugs, essentially you are giving him the gift of life, because it's those drugs that allow the patients to be alive and to be well and to be able to look after themselves and their families.